Welcome back, Mitochondriacs, for another episode of Cancers and Mitochondrial Metabolic Disease. We're going to be talking today about some additional strategies that we have in our tool bag as a way to lower blood glucose. If anybody is familiar with mitochondrial metabolic therapy as a treatment or a strategy for cancer, you will know that getting your GKI or your glucose ketone index and your average blood glucose down to somewhere below 80 milligrams per deciliter on average is going to be like a foundational principle. And all the other treatments that we use are going to be building on that foundation. So the last time we were talking, we talked about some important, I guess you'd call them vitamins, but some of them like vitamin D and melatonin are hormones. And then a mineral called chromium. And I'll just be very frank, chromium probably has the most effects that I've seen on blood glucose and A1C than any other mineral. But that doesn't mean it acts alone or that there aren't other minerals that can be very helpful to help lower your blood glucose. And although this kind of like discussion is really built for people who are trying to do metabolic therapy and trying to improve their glucose ketone index so that they can, have the best shot, this could clearly also be, useful for people who are not cancer patients and who have, prediabetes, diabetes, or even weight issues. Insulin is a very strong kind of storage hormone. Not demonizing it by all means, we need it, but when it's in excess, it can lead to weight gain and all kinds of other downstream problems. So this would also be dovetailing into those folks as well. So let's get into talking about the first mineral for today, and that is magnesium. And this paper is titled Magnesium and Type 2 Diabetes Mellitus, Clinical and Molecular Mechanisms. And it says here, in addition to the above factors, magnesium deficiency has been associated or has been linked to an increased risk of developing type 2 diabetes in the general population. The homeostasis of this ion is highly regulated by absorption in the intestine, storage in bone, and renal excretion. However, magnesium content in the diet, the primary source for the body, and the content of magnesium in fruits and vegetables have progressively decreased. So Western-style diets currently contain between 30 and 50% of the minimum recommended magnesium. Since magnesium deficiency has been associated with higher fasting glucose concentrations, glycosylated hemoglobins, that's hemoglobin A1C, and higher insulin resistance rates in patients with type 2 diabetes, magnesium supplementation may be a potential therapy to treat diabetes. And I pulled this paper in particular because it had fantastic graphics, and it really shows the importance of magnesium for the entire human organism. There is that, kind of like classic thing people say that like magnesium participates in like over 300 different biochemical reactions. And, this doesn't per se show all of that, but it shows a lot of where magnesium is important. So this is in like a normal kind of cell, right? And the cell, we can just to get oriented here, we have the cell membrane, we have this GLUT transporters, we have some potassium ATPases, we have some calcium channels, we have the mitochondria, right? And then here's the this is insulin being secreted from the pancreas. Okay, so the pancreatic beta cell, and you can see here they may not exactly know where magnesium works at, but they have hypotheses where they don't quite know, right? So, for example, magnesium is going to be important for the transcription or translation of the mRNA, the GLUT2 transporter, which is going to be responsible for going to the plasma membrane to absorb glucose and let the body know that there's glucose in the system so that it knows when to release insulin. And it's going to also be part of several other pathways within this. Everywhere you see a little magnesium 2+, that's where magnesium is acting. So magnesium is central to these processes, these biochemical processes within the pancreatic beta cells to detect when glucose is at a certain concentration, and then being able to have the power to actually release the insulin into the systemic circulation. Then on the flip side, we have a blow up of the liver. And we see here that in the liver, we have these insulin receptors, right? Which magnesium is likely responsible for affecting multiple steps upon those pathways. It's also responsible for, gene transcription or the lack thereof, as well as many other pathways with GLUT4 and PPAR, gamma, et cetera, et cetera. So, I'm not going to attempt to explain what all these pathways do in this particular video, but I'm just trying to illustrate essentially that in the two very important organs that relate to blood glucose and insulin, both the pancreatic beta cells as well as the liver cells that make where the gluconeogenesis can release basically glucose into the system on demand, depending on the level of the blood glucose and insulin, then magnesium is central to those parts. So you would imagine that, as this paper says here, that when there's a deficiency in magnesium, and they're saying that the average standard American diet has about 30 to 50% of the minimum required need of magnesium to be healthy, right? Which is why we see magnesium deficiency all the time in clinic and in the hospital. It's very, very common. And so it would not be surprising that increases risks of type 2 diabetes mellitus. So there's one aspect of magnesium is make sure you're not deficient, right? Because that'll set you up for diseases longer down the line. And this is just one example of a disease that it could potentially set you up for, and that's diabetes, right? That being said, on the flip side, if we give magnesium, is there any benefit, right? So in this particular study, they looked at the use of oral magnesium on people with diabetes, people who have, chronic hyperglycemia, and they gave 250 milligrams of elemental magnesium, and they showed the A1C improved from 8.32% to about 7.96%. So, someone had made a comment in one of I think the last video saying that, 0.3% A1C is not that good. And I would say that you're right. It's not like it's blowing it out of the water by all means. It's not like like Ozempic or a pharmaceutical would be. But, when you start adding in, let's say you took a multi-mineral and you got, 200 to 400 milligrams of chromium, and you're getting another, couple hundred milligrams of magnesium, and you're fixing the deficiencies, these things start to work in combination. So you're likely going to get more of an accentuated effect. This is just looking at magnesium in a vacuum, or chromium in a vacuum, or vitamin K in a vacuum, right? So anyway, I'll digress. But insulin levels dropped from 15 to 12. And then, looking at the HOMA-Rs and the HOMA-Bs, they also showed improvement. So going further down, this is a meta-analysis of magnesium supplementation for glucose control. This was published in 2016, and it showed a meager, kind of 0.1% A1C. And you'd say, well, that's actually not at all really, effective probably. But what they found when they actually when they subcategorized the study is that there actually was significant drops if the person was on magnesium for 4 months or greater, right? So whatever amount they were taking in the average amounts of these studies was probably not enough to move the needle. To be very frank, in this study where they were doing 250 milligrams, that's not that much magnesium. One serving of most magnesiums you get over the counter is somewhere between 300 and 400 milligrams for every serving. So, to do only 250 is not that much. And it just goes to show that likely you have to kind of fix a profound deficiency before you start to actually get the benefits, right? So for whatever doses they were giving in this particular group of studies, over what period of time, they showed that it had to be at least 4 months to see the significant difference in the fasting blood glucose as well as A1C. And then here's a newer meta-analysis, a pooled analysis of 24 randomized controlled trials using magnesium supplementation. And it says here that the pooled analysis of 24 randomized controlled trials of 1,325 individuals with diabetes received magnesium supplementation had statistically significant reductions in plasma glucose, glycosylated hemoglobin, systolic blood pressure, and diastolic blood pressure. That's actually one of the other, areas where magnesium is pretty impressive is with blood pressure. Obviously, we're not talking about it in this particular setting. We're talking about blood glucose because we're trying to get people's GKI to be improved. And so we're going to focus on the magnesium part of it, or the blood sugar part of it, and A1C part of it. So they found a significant decrease of A1C for about 0.2% in this particular meta-analysis. And we'd have to tear it apart to see how much they were giving and stuff like that. It did say later on that there was a dose effect that showed that 279 milligrams per day versus 429 versus 300 our average kind of optimal dosing for improvements in glycemic control. So either 279 for 116 days showed control, or if you did 429 milligrams per day for 88 days, that showed control, or 300 milligrams for 120 days. So, in these cases, it's probably better to fix the deficiency first. Have your doctor check your serum magnesium or your RBC magnesium to see kind of where you're at, and then that helps us know how aggressive we need to be as a value. And then, so again, not exactly like earth shattering, but again, when you start taking these things in combination, then you're going to see a likely much larger benefit. And also, you're going to see a much larger benefit when we start talking about flavonoids. But I want to at least cover these. So the other mineral that I would like to talk about in this particular setting would be zinc. And in this paper is titled, Zinc, Effects of Zinc Supplementation on Glycemic Biomarkers, an umbrella of interventional meta-analyses. And this is fairly new. This is June of 2024, right? So this is probably about the most up-to-date data we have. And they showed that, zinc supplementation was effective at reducing serum blood glucose by about 13.5 points. And then the A1C dropped on average about 0.35, right? So again, none of this is going to be as effective as some of the flavonoids and some of the phytochemicals we'll be talking about. Some of them are actually quite impressive, much more impressive than I was expecting. But magnesium is an easy, cheap, and necessary part of all of our lives for proper function of our body. I mean, remember, more than 300 enzymes are requiring magnesium, and there's a huge amount of deficiency within, at least in the United States, people getting 30 to 50% of what is the minimum recommended dose, so definitely this is something that needs to be on our radar as being a low hanging fruit, something that we can check easily and pretty much fix easily too for a pretty cheap amount of price. So zinc also is one of those low hanging fruits. It's something you can easily check. You can check a serum zinc, or you can check an RBC zinc, have your doctor do that, and see where your zinc levels are. And that can also correlate with, zinc is also very important for the immune system and helping against upper respiratory infections, influenza, COVID, et cetera. I've done videos on that in the past with zinc, how powerful it is for infections. But today we're talking about glucose. So as you can see here, zinc has almost a GLP-1 effect, similar to like an Ozempic. Do I think it's as powerful as Ozempic? No, I don't. Not that I recommend Ozempic either. But that being said, I'm saying I don't think it's going to be as powerful as an effect as that. But it's also going to aid in insulin secretion from the pancreas, as well as improving insulin receptor functioning, as well as downstream pathways that deal with glucose uptake that actually inhibit gluconeogenesis. And so I think that zinc could also be a good addition just to a daily regimen. Again, we're talking mostly about people who have cancer and trying to lower their blood glucose as a way to improve their GKI. But this could, again, have much larger effects on the population at large who just have insulin resistance, who have, difficulties losing weight, et cetera. I think that there could be some help with zinc. And then zinc also, again, the part that is more kind of worked out is zinc's critical role with inflammation, oxidative stress, and improving immunity to help with infections. And this was a meta-analysis from 2019, and it showed that the fasting blood glucose was decreased by about 14 milligrams per deciliter, which is pretty significant. Fasting insulin was down 1.3 milliunits per liter. And then glycosylated hemoglobin in this particular meta-analysis was as much as 0.5%, so 0.55%. So that's even more significant than the first study, the first meta-analysis, which showed about a 0.35%. So somewhere between 0.3 and about 0.6% probably, A1C improvement just with zinc only, which I think is pretty remarkable for something so easy, cheap, simple, and necessary. And it just goes to show like how important these minerals are for our overall function. And again, going back to the chromium in this one study lowered people's A1Cs by nearly 3.2 points, right? When they did it in a meta-analysis, it was closer to about 0.7, but still 0.7 is unbelievable. So, I mean, not unbelievable, but it's really good. And so, these three minerals in combination are potentially very effective. And as you can see here from the chromium paper, again, it's responsible for multiple areas of both the sugar, the glucose transporters, as well as insulin signaling. It's not just does one thing, right? Just like magnesium and just like zinc is going to have. So these are some easy, quick hacks that you can add in to your daily regimen. Now, where the discussion gets a little bit hairy, okay, is when we're talking about magnesium, because we know that in particular in the setting of cancer, we don't want to feed the cancer, right, with anything possible. So like a couple of things that I think could be, maybe not a great idea. That being said, I think it's nuanced, but what I'll say is that magnesium glycinate, given that it's magnesium attached to a glycine molecule, and glycine being one of the 3 amino acids that make up glutathione, and given our goal of metabolic therapy is depleting the cancer cells of glutathione so we can hit them with oxidative stress and kill them, magnesium glycinate may not be my first choice. Neither magnesium citrate, although it's one of my favorites, to use calm magnesium. That's one of my favorite supplements. I think that, when it comes to cancer, giving extra citrate to people may also be a problem. Magnesium malate, it may also be a problem. So I think there's some nuance with this in terms of like what you want the magnesium to be attached to. So that's where maybe threonate or oxide or chloride, could be better options within cancer. That being said, I want to actually kind of critique even that of, that thought process. And that is, we're talking about like giving milligram quantities of these things, right? If you were to take a protein powder, you may have 4 or 5 grams of glycine, right? Whereas in a magnesium supplement, you may have a mere couple hundred milligrams. So is that minuscule amount of glycine that's part of magnesium glycinate really a problem? I mean, probably not, but I think it's at least worth talking through and thinking through, and maybe thinking about different forms of magnesium while if you're potentially dealing with cancer. So the next compound or mineral that I'd like to talk about is called vanadium. And vanadium is kind of got an interesting history. It's been studied it's been potentially utilized for diabetes since 1899, and it's still being studied, as of today. So like it is got a long history, and it is probably more nuanced than the rest of these minerals. So in this one called vanadium compounds with anti-diabetic potential, it says here that an overview of the main hypotheses explaining the biologic activity of these compounds is presented, particularly with the most accepted pathway involving vanadium interaction with phosphatase and kinase enzymes involving the enzyme signaling cascade. From our point of view, the major discoveries regarding the pharmacological action of this family of compounds are not fully understood. Thus, we still believe that vanadium presents the potential to help in metabolic control and clinical management of diabetes, either as an insulin-like drug or as an insulin adjuvant. They're saying we'll look over the 40 years of research, right? And so this was a graphic that came from that same paper. And basically, it shows, again, the importance of vanadium as an anti-diabetic, right? There's all kinds of different pathways that it potentially influences, redox chemistry, as well as even lipid alterations, right? So it's got multiple factorial things. The issue is that there could be some problems with it long term. So I'm going to read off a couple of these. This is from basically a meta-analysis or looking at it from a historical perspective. And they're saying that one of the most systematic experiments, the study developed by Cohen and colleagues in 1995, was the first clinical trial using inorganic vanadium compounds to treat diabetic individuals. In this case, vanadium sulfate, the drug orally administered 50 to 125 milligrams per day for 2 to 4 weeks. Results have shown improved plasma glucose levels and daily insulin requirements, aka less insulin required for the person if they're insulin dependent. And then in type 2 diabetes subjects, it was verified that increased sensitivity to insulin and a reduction in plasma glucose levels and glycosylated hemoglobin, or hemoglobin A1C. Unfortunately, it didn't actually tell me the exact values of these. It was just going over what this particular study showed in general. These studies were sustained for up to 2 weeks after the administration of the compound. So it has not only did they do it for only 2 to 4 weeks and got results, but the results would maintain for 2 weeks after the last dose of administration, which I think is pretty cool. It has kind of a more lasting effect. In 1996, a study performed by Halberstam et al. At Albert Einstein College of Medicine inspected the effects of oral vanadium sulfate 100 milligrams per day and non-insulin dependent diabetes mellitus patients and non-diabetic subjects, considering the administration of 2 weeks of a placebo or 3 weeks of vanadium compound. The plasma glucose remained unchanged in the non-diabetic patients, and fasting blood glucose and A1C decreased in diabetic patients. Only minor gastrointestinal discomfort and stool discoloration has been found as a side effect. In the same year, this Bowden and colleagues also did another study where they looked at 50 milligrams of vanadium sulfate twice daily for 4 weeks and followed them for 4 weeks. Followed them for more than 4 weeks with the patient who was treated for a placebo. And they showed also decreased fasting plasma glucose levels, administration just in 4 weeks of this. So in this case, they did see some GI upset, looks like some diarrhea, gas, nausea, and some abdominal cramps were observed. And, I'm not sure if that's the dosing, they were using higher doses or the fact that they were splitting the dose. It's hard to know. And then in 2001, lastly, this Kusi and colleagues studied the effects of vanadium sulfate, probably at the highest dose we've seen studied. This is 150 milligrams per day in type 2 diabetes over a period of 6 weeks. And the author verified significant improvements in glycemic control indicated by a decreased fasting blood glucose as well as A1C levels. The treatment was well tolerated with minor side effects, mostly related to gastrointestinal. So that seems to be like the classic kind of side effects is the gastrointestinal system. And this is a paper talking about the potential kind of like mechanisms within, cells that where everywhere you see a V, it's affecting whether the insulin receptor itself or the GLUT transporters or the TCA cycle or several other things like glycogen synthesis. So it has kind of a multi-pronged approach of how it has effects. According to this paper, the mechanism of action of vanadium salts are still poorly explained. Vanadium complexes are cofactors for several enzymes and exhibit insulin mimicking properties. Thus, they are involved in a regulation of glucose metabolism, including patients with diabetes. The issue is that there's potentially some side effects. So let's go with the first things first. And so vanadium compounds and diabetes and metabolism, this is kind of like multiple ways that it can help. It can help with insulin signaling as well as glucose uptake, leptin signaling, adiponectin signaling. It can increase AMPK, a key nutrient signal, as well as PPAR gamma, and as well as several other kind of pathways like these mitogen activated protein kinases, which also increases insulin sensitivity. The effect is that you have a fasting blood glucose is lower and A1C that's lower, glucose lower in the urine, as well as reductions in body mass and some cholesterol stuff as well. So, it seems like there's pretty solid backing for the use of vanadium for the right person. It seems like in particular, it seems to affect diabetics more than people who are not diabetic. So if you're a diabetic and you're trying to get your blood glucose down to start metabolic therapy, then this could be a potential, thing that you could add in to your regimen. That being said, there are some potential toxic effects to this and having some, when using it in long periods of time. So what they basically said was, if you're going to use it for a short burst, maybe like a month at a time, take a break, maybe a month at a time. It could be, they hypothesize it could be like maybe increasing oxidative stress, to a degree after you hit a threshold or have a period of time with it. So it may not be beneficial for ever, but it could be a quick short-term strategy to add to like a multi-mineral as a way to help yourself. And a lot of the major supplement companies will have a diabetes, or not a diabetes, but they'll have like a blood sugar support, supplement, right? And so let's say Metabolic Maintenance has theirs, and Designs for Health has theirs, and Vital Nutrients has theirs, and Pure Encapsulations has theirs, and they all have like a bunch of stuff in it, right? And it's going to have, of course, it's going to have biotin, it's going to have chromium, it's going to have, likely it's going to have cinnamon and some of the flavonoid stuff we'll talk about in the next couple of videos, because there's a bunch of flavonoids that have been shown to be very effective, more effective than the minerals. Maybe not so much more than chromium, because chromium is pretty powerful, but the other minerals and vitamins clearly more powerful than those. And so these flavonoids are a lot of times in those formulas as well, which we're going to talk about as being, a blood sugar support kind of formula, right? And generally, what I've seen is several of those companies will also have some vanadium in it, and it just goes to show it's probably not something you want to be taking for the rest of your life, but maybe in short bouts to get your blood sugar down, in combination with other lifestyle things that, of course, are going to be as important or even more important, than getting your blood sugar down. So let me see if I can't answer some of these questions. So before I answer the questions, I'm going to say a couple of things that I did not put on this list out of safety. Okay. So one of the most powerful anti-diabetic kind of supplements is actually NAC, okay, N-acetylcysteine. But since we're talking about cancerous metabolic disease, I don't want that to be on anybody's radar, because that could potentially cause harm. Okay, so if you didn't have cancer, for example, and you have diabetes, or if you have blood sugar issues, or you want to lose weight, NAC could be a great addition to your regimen. It's it's a powerful detoxifier. It helps boost glutathione, but it also is I think it's actually, if I'm not mistaken, in head-to-head studies, it's as effective or even more effective than metformin at lowering blood glucose and lowering A1C. So it's a very powerful intervention. It's just that I don't want anybody within the cancers and metabolic disease realm to be exposed to NAC, because I don't want there to be confusion about it. I mean, it is a powerful tool, but for cancer, I think you're gonna be shooting yourself in the foot. The other one that I didn't mention was selenium. Selenium, again, I don't want anybody to be deficient in selenium by all means, but taking selenium as a supplement is gonna potentially boost antioxidant capacity and glutathione, and therefore, again, we would be shooting ourselves in the foot by taking extra selenium. So I didn't mention those, but they do have effects on blood glucose as well, from a more general perspective. Which antioxidants are protective of cancer and which should not be taken? Yeah, that's a great question. I was actually doing a bit of reading yesterday about ferroptosis, and it was talking about ferroptosis inhibitors being vitamin A, vitamin E, NAC, glutathione. So those are things that can inhibit ferroptosis, right? Because they're antioxidants, and they protect against lipid peroxidation because they're lipid, at least the vitamin A and vitamin E are lipid soluble. CoQ10 would be another one that I would probably avoid if I had cancer. But unless I see better data, I think the mechanistic studies I've seen is that CoQ10 actually enhances the protection against ferroptosis. So therefore, some of the things like curcumin will actually lower CoQ10. Statins will lower CoQ10 in the short term as a way to enhance ferroptosis. So those are some of the antioxidants that, and of course, vitamin C, oral or liposomal, I would not take if I had cancer, because no matter what dose you're doing, you're likely not going to get the serum concentration to get the paradoxical pro-oxidant effect that you get from high-dose IV vitamin C. Why take berberine over dihydroberberine? Yeah, great question. I think that dihydroberberine is what berberine is converted to be absorbed. So dihydroberberine is kind of like cutting to the chase. Let's take the more absorbable form. The issue that I have with dihydroberberine is that, some of the proposed mechanisms of how berberine works, and we'll talk about berberine in the next couple of videos, but one of the proposed mechanisms of how it works is it actually affects the intestinal microbiome, which then lowers inflammation, which can potentially lower blood glucose through that mechanism. So if you take something that absorbs very well, then you may not get the benefits of its effect on the microbiome. Let's see here. Let's see here. How's NAC related to berberine? Let's see here. Chris, what brand is that? Um, would magnesium BHB salt work? I can get both magnesium and BHB salt. Yeah, so I think that is a strategy that you could use for sure. Is using magnesium salts or BHB salts. Most of them are either going to be a calcium, sodium, or potassium, or magnesium, as the anion, and then the BHB attached to that. So yeah, that could be okay. You have to look and see how much magnesium is actually in it, though, right? For the whatever grams of BHB you're getting, to make sure you're getting a therapeutic dose. Another thing you could do is you could, like, a lot of the BHB salts, they have about the same flavor. There's nothing that's like rocking, anybody's taste buds. But for example, I have the Dr. Boz one, that's tastes about the same as everyone else, and it kind of dovetails nicely into the calm that I use, the magnesium calm that has a raspberry lemon flavor. And so sometimes when I do BHB, I'll add some magnesium to it. Or for example, like I'll use Element. I know there's some controversy with Element, but I like Element electrolytes to put in my water. That's actually what I have in my Evian right now. And I put a little bit of calm and a little bit of sea salt, to give a little more magnesium to my water that I drink. So someone else asked, how much zinc and magnesium and what types? Well, we kind of talked about types and the nuances there, right? How much? Yeah, it's a great question. I mean, I can't give medical advice over the internet, right? But I think the RDA for zinc is like 15 milligrams per day. So at least that, right? And then magnesium is going to be higher. But again, like one serving of like calm or most magnesiums are somewhere between 200 and 400 milligrams. And you don't really want to do much more than that at a time, because if anybody knows anything about magnesium, and also if you give enough of it, it will cause diarrhea. We give it actually as an anti-constipation medication in the hospital, magnesium citrate, like a very large bottle of it. But so that's kind of the only like downsides to magnesium, is you're kind of limited by absorption, which is why when people have serum magnesium levels that are very low in the hospital, you really can't give enough PO or by mouth to replace it. So we give magnesium sulfate, IV, like gram quantities, like 4 or 5 grams, depending on the person. So it just depends on your deficiency level, or if you're sufficient, but you just want to supplement, how much you would take, etc. Magnesium taurate, I don't know. Maybe. I don't think there's any that I'm not aware of any harm by giving taurine, the amino acid, nor threonine. But that being said, so magnesium taurate or magnesium threonate could be okay. We're going to do someone said we'd like to see an analysis of berberine. Oh, it's coming. Don't worry. It's going to be in the next, probably next week. We'll cover it. Let's see here. Just redacted. Uh-oh. What happened? I'm not sure what happened. Some love from Morocco. Get some love from Florida here. Hydroselenium selenite. Yeah. So selenium itself is an antioxidant, but the selenite is got actually a paradoxical pro-oxidant effect. And I've even seen cancer studies using selenite by itself having effects. So that's actually something I'd like to cover at some point, is the selenite. I'm actually interested in that. Tocotrienols versus tocopherols. Well, yeah. So what I'd say is that most people, when they take a multivitamin, are they going to get D-alpha tocopherol, right? Which is like the kind of prototypic, fake vitamin, right? Lab made vitamin. And it's just one of I think there's like 8 or 9 different, isomers of vitamin E, the tocopherols and tocotrienols. And the bottom line is, unless I have evidence to the contrary, I would avoid fat soluble vitamins, such as vitamin E. At least don't be deficient by all means, but don't take extra is what I'm trying to say. Probably not a good idea. Epsom salt. I like the salt bath. I don't do Epsom. That's magnesium sulfate, but I like the magnesium chloride flakes that you get. You can get them at Whole Foods, big blue bags, pounds of them. Those can be pretty good. Sometimes they have little scents and stuff that even I think some of them have lavender to even help calm you more. I don't like that per se, but the magnesium flakes are good. Even magnesium soap, the tanks you do, or you can do the relaxation tanks. Those are filled with magnesium, which is how it helps you float. So those kind of things too. But I think those can be other ways of getting magnesium. They even have magnesium sprays that you can put on your body. I find it pretty cumbersome, to be honest with you. But there's many ways to get magnesium in. Magnesium chloride, blah, 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 soaking, spraying. Yep. Shilajit, I don't know enough about. I mean, I've taken it many times, but I don't know enough about to say if it has effects on blood glucose. Cold plunge with magnesium chloride. So, yeah, if your cold plunge doesn't have a motor, that doesn't have a chiller, I guess I'd say, because they're going to have filters and stuff like that. You may damage the filters, or just may frankly just get rid of the magnesium with the filter. I'm not sure. I don't know how powerful those are removing things like magnesium, but yeah, cold plunge with magnesium, that would be pretty cool. So we're about 35 minutes in. I've covered as much of the minerals today as I want to cover. So I think we're going to cut it off a little bit earlier than we normally go. And then we're going to start up the next one talking about flavonoids. Okay. There's a bunch of different flavonoids. There's a bunch of different, phytochemicals that have been studied that have profound effects on blood glucose. And I look forward to sharing some of those. Some of those you may know about, some of those you may not know about, and hopefully we can just keep adding and adding and adding tools to our tool bag. Yeah, Steve says I use ancient minerals. That's a good one. I've used that one from the Dead Sea. I've tried that one. For bathing, magnesium with malic acid, produce hydrogen in the water. Interesting. Okay, well, let's just talk about let's finish up with minerals today, and let's get into flavonoids the next time. So on Monday we'll start up on flavonoids as more and more tools in your tool bag that you have to lower your blood glucose, to improve your diabetes, to improve your GKI, and just overall improve your health. And we're going to try to have an exhaustive list of everything known to man that can help you with that endeavor, and get you on track for maximum, metabolic therapy efficacy. If you like videos like this, please like, share, subscribe, and until next time.